You don't have to read the press for long to know that there's an access crisis within the NHS. The NHS has identified this through things like the Primary Care Access Recovery Plan, which has been backed up with the Digital Pathways funding. That's now expanded to include things like demand and capacity planning tools, which are critical to support the NHS in driving better patient access to services. Our solution, Apex, can support GP practices, primary care networks, right through to ICBs in accessing critical data to support better understanding of demand to then predict the future and plan capacity in a much smarter way. We've got ICBs who are harnessing those data insights to understand the types of patients, the nature of their presentations, so that they can effectively plan to have the right resources, the right skill mix in the right place for the right patient need. Apex empowers both ICBs, PCNs, GP practices and every layer in between, right down to individual clinicians, to understand the workload and to get those critical insights in highly visual dashboards so that you have data at your fingertips to drive data-informed decision making. It's time for the NHS and particularly primary care to wrestle back control of its own narrative and its own story. Too often the press will tell the story of general practice access. If you can take access to data into your own control, using a tool like Apex within your practice and across your ICB, you will have a better understanding and be able to dictate that narrative so that you can tell exactly what is happening to support integrated care, but also redesign services for the future.